Okay.
Hey, you're back.
And Michael, how do I pronounce your last name?
It's Ketslakh.
Ketslakh. Okay.
Ketslakh.
All right. And what you guys are working on is, well, we're working with the NDS on service lines impacted by the coronavirus. And so how have things changed for you?
Yeah, so it's great. So our business traditionally is we're operating clinics. We operate fixed clinics and mobile clinics in primary care, in neurology and cardiology space. And a lot of those things became non-essential literally immediately when this coronavirus hit. So one of the things that we had to do, and with our 200 plus employees, is really be able to convert some of our assets, and those assets primarily being the employees, in order to respond and provide services during this epidemic. So one of the things that we're doing is we're asked by the city of Philadelphia to provide radiology and cardiology diagnostic services in their step-down unit that is taking COVID patients for the overflow of the hospitals. It's a FEMA-run operation, military and city emergency services. So we've deployed that literally within 24 hours to operate that 24 hours a day. For folks like consumer power and essential businesses, we have our teams traveling throughout the very large geography to screen individuals, to test individuals, to make sure that current infrastructure is working properly. A couple of really interesting things from a perspective of actual testing for the coronavirus, using that PCR test with a swab. We are operating an entire triage line for Union County, New Jersey, and that's about 600,000 individuals. And we're able to take in calls, triage individuals based on medical decision tree, and then those individuals that would qualify for testing. And obviously we have very scarce resources, so we have to make sure that it is the right people that are getting tested. And those individuals are connected via telemedicine to our physicians. Those physicians are consulting them, educating them, helping them to develop care coordination guidelines, and those that qualify for the testing, and getting them scheduled into a testing center run by the county officials to make sure that the individuals that are sick, symptomatic, are coming in a very orderly method. So they're not waiting for hours and hours on end. And those very, very scarce resources are being handled. So that's kind of what we've been doing as an immediate response. And we had to work, our team, I'll give them a lot of credit. They've been working 7 days a week, 8 days if it's possible, 24 hours a day to really be able to deliver and convert for our traditional services to what we're doing right now. And then we're working, obviously, on coming back to work programs, which are so important for our economy to get that back and going.
So, Michael, for people who aren't familiar, why don't you tell them a little bit about NDS, where the company is and the services it provides?
Yeah, NDS, we've been in business for 20 plus years, 22 years. We're a Michigan-based company, but we do operate across the nation. And we operate really, our focus programs are to provide radiology diagnostic services. We support hospital systems throughout Midwest and the East Coast. And then we also operate very interesting mobile clinics with providers. And the purpose of those mobile clinics is to really go out to facilities like manufacturing plants where people don't have access to primary care, and people that are not being managed for chronic disease, hypertension, diabetes, and get those folks engaged with primary care earlier on when those diseases are still asymptomatic. So folks are not showing shortness of breath and signs, and trying to identify them earlier on, educate the people on what needs to be done next, and trying to engage them into the primary care or appropriate level of care in their communities to get them managed, to get the workforce to continue to stay healthy.
So these mobile vans now, I think what I read from my notes was you were dedicating a lot of those to corporate folks so that you can return people to work, so that they would go through these vans. They would either be checked out as positive or negative or have a temperature or something. And then if they were okay, they proceed to go into wherever they're working, right?
Yeah, that's correct. So The initial response with testing being so limited and availability testing so limited, we're really looking at identifying individuals who are symptomatic. So, had symptoms of COVID, potentially having a high temperature, identifying those individuals and getting them out of that space so other folks are not infected, and getting them to be quarantined, managed with a provider. The next phase of it we're really getting into is what you guys hear a lot about, is the antibody testing. And primarily, antibody testing will probably be the key to bring the workforce back, from a perspective that a lot of individuals with COVID who are asymptomatic, may have always been asymptomatic, and right now the data is coming out where that's potentially 20 to 50% of individuals infected. With an antibody test, which shows how our bodies respond to potentially this virus, we can identify those individuals, then engage them with primary care, follow up with a confirmation of a PCR test, and seeing if there's a viral load and that viral load still active, and then hopefully manage those folks, help them to get managed, and get them back to work.
So when the pandemic is over, and of course none of us know that, how are you going to use these then going forward? Will they go back to their original purpose, or what? These vans, I mean.
Well, I think that from a standpoint of the response to the pandemic is going to be over, but the fact that we're going to have to continue to have a safety program in the workplace, so we don't have that second bounce back of folks getting infected. I think those programs are going to be in place for some time. The idea is how to do it so it's cost effective, how it is technology based, so you can identify these individuals and have technology help you track these individuals until they have, for example, 2 negative PCR viral tests, so they can go back to work. So those components are going to be there. For our traditional business of chronic disease, we are integrating that type of testing before those individuals are seen. Again, from a perspective of making sure that the person's educated about what's going on. Have they ever been exposed? Are they potentially contagious now? And really, for our medical staff to be able to be safe in order to be able to provide those traditional healthcare services.
People have been talking about telemedicine for a long time now, 20 or 25 years. Do you think this pandemic might finally usher in sort of a new age of telemedicine, and what's that going to look like?
Yeah, it's so telemedicine has had a very difficult uptake for just a lot of reasons. Number one is it is extremely important for a patient and a physician to have a physical interaction. There's a lot of stuff that occurs there, a lot of communication, a lot of things that the physicians learn. However, with this pandemic, one of the things we've been able to learn is actually there's tremendous amount of technology out there, and we can achieve a lot of medical conclusions using this technology. The fact that now, and I think that's going to be significant. I don't think that's going to change. I think that the fact that people are being accepting of it because of this certain situation, that will continue to change the healthcare. I think the healthcare as we see it right now with folks just coming into primary care offices will forever change. And a lot of our providers will have to adapt to this technology. And they've already adapted very quickly.
Moving forward, though, I mean, certainly there's a big section of the population, I don't know, it's a minority section of the population that doesn't either have access to the internet or may not have access to computers or any way of communicating through telemedicine. How are we going to help those folks? Any ideas?
It's problematic. So you can have an interaction that is a telephonic interaction. However, in that situation, there's a lot lost. My personal family had a scenario, a medical emergency this weekend, and I had to take my father to the ER. And then when I brought him home, I set up a telemedicine consultation with one of our neurologists. And because of that technology, the neurologist was able to take a look at exactly what symptoms we wanted to address and he wanted to evaluate. Without it, you become somewhat limited. So there is telephonic option there, but it is never as good for a variety of reasons.
Matt?
Okay. Well, we got about 2 minutes left here, so I just wanted to give you a chance to sort of give your website, do a little bit of a shameless pitch here, let people know how to get a hold of you and the services that you offer.
Sure, you guys. Well, listen, thank you very much. Thank you for the time. You can go to NDS Wellness, NDS, like National Diagnostic Services, acronym ndswellness.com. Please reach out to us. We can always reach us by phone at 248-476-6980. I appreciate the time, you guys.
Traditional four-year students love Lawrence Technological University's thriving campus life, but LTU has always met non-traditional students' needs too. Lawrence Tech offers over 100 degree and certificate programs that can get adult students started or back on track. And most of our classes are conveniently offered evenings at our beautiful Southfield campus or online, so you can balance your social, family, and work life even while you power up your career. Lawrence Tech, where Blue Devils dare.